Administrator for Ventura County Public Health. And we're honored to be here tonight with all of you to hopefully answer questions, address any concerns that you might have regarding schools opening. Moorpark Unified, I believe, went back today. I have with me Erin Slack, who is one of our epidemiologists here with Ventura County Public Health, as well as Luca Vieira, who is one of our senior registered public health nurses. So we're here tonight to present, like I said, answer questions that you might have. So with that being said, what we're going to do is I'm actually going to start with Erin, and she's going to do a presentation for you on COVID-19 in our county, what our data looks like, and explain our tiered system to you as well. So I'm going to go ahead and turn it over to Erin. Hopefully she can unmute herself. There we go. Erin, are you there?
Yeah, I'm here. Sorry about that. It wouldn't let me unmute myself. And I'm not sure why, but it's not letting me share the video, but that's okay because I have a slide deck. So if you want to go ahead and bring up the slide deck as I introduce myself. My name is Erin Slack. I'm the maternal, child, and adolescent health epidemiologist here at Ventura County Public Health. And as the maternal, child, and adolescent health epidemiologist, I've been redeployed for the COVID response over the last 6 months. But I'm really glad to be able to speak with you today to talk about our data here in Ventura County, and mostly because I know what an important role that education has on overall health and wellness across the lifespan, and how important it is for our community to get back to in-person instruction in a safe way for both students and staff, so that we can ensure both mental, physical well-being for all of our students and teachers and staff within Ventura County. So this first slide that you see today is a county comparison for the Blueprint for a Safer Economy. When Ventura County first started opening back up after the original stay while at home order was put in place, it was about mid-May, and we filed an attestation document with the state of California and the California Department of Public Health to move through the reopening phase at an accelerated pace. And when we did this, they began monitoring all of the counties on 6 different indicators. And those county monitoring metrics were around until the end of August. And then the governor's office decided to change the monitoring metrics. And now we've gone to this Blueprint for a Safer Economy, which is a tiered system. When it was first unveiled, it was based on the case rate, which is a 7-day average of a single day case rate with a 7-day average and a 7-day delay, and our positivity rate, which is also a 7-day average with a 7-day delay. And then about a week and a half ago, I guess 2 weeks now, they also added a health equity metric, which I'll talk about in more detail. But what this slide shows you is Ventura County is currently in the red tier. And the red tier is the second most restrictive tier. So the purple is the most restrictive tier, which indicates widespread transmission within a community. And then the red tier, the second tier, is the second most restrictive tier, which indicates substantial transmission, but not widespread transmission in a community. And I'm sharing this information with you. A new set of these blueprint metrics is going to come out tomorrow on Tuesday. I'll give you a little sneak peek of Ventura County's data, but this shows Ventura County in comparison to other counties. But what I really wanted to talk about here is the fact that the case rate in a county is really tied to how many people that you're testing. So the more people that you're testing within your community, the higher your case rate may be. And so when the governor first unveiled this tiered system, communities that wanted to move through the tiers at an accelerated rate started reducing their testing capacity. So they were testing less than what they were under the county monitoring metrics. And the governor's office became kind of aware of what certain counties were doing. And so now what happens with our case rate is they take the state median average. Well, it looks like we've got somebody writing on the screen, hopefully. Thank you to the Moorpark person that's moderating this. So the case rate that you see there will be adjusted based upon the testing rate. So for this most recent measurement period, we had a state median average of 239 for the testing volume per 100,000 population, and Ventura County was at 273. So this meant that we got a case rate adjustment in a positive direction. Our overall metric for the case rate was 5.5, but because our testing capacity was above the median average, we got adjusted down to 5.2. In some communities where their testing volume falls below the median average, they actually get an adjustment in an upward direction, which is a negative direction. So for instance, in Riverside, their case rate, I believe, was 7.8 and got adjusted up to 9.2 because they were well below the state median average for testing. So just to keep in mind that our testing rate really does influence our case rate. The positivity rate is really the total number of positive tests over the total number of tests. And this isn't deduplicated depending upon if someone gets tested more than once during a period. And this is the same for the health equity metric as well. And we'll go into this in more detail on future slides. If you want to go to the next slide, Salita. So what you see here at the top are the 3 different metrics that are currently under the tiered system. So in this last measurement period, we were at 5.2. With the data that's coming out tomorrow through the California Department of Public Health, we're actually going to be at 5.1 for our case rate. We've been steadily declining ever since the metrics went into place. For our 7-day positivity rate is currently at 2.7 with the tiered metrics, but tomorrow when they release the data, we're going to be at 2.4. And then for our health equity metric, which is a 7-day testing positivity rate, we're going to go from 3.8 all the way down to 3.1. And the other metrics that you see here, so the change in 3-day average hospitalized patients, percent ICU bed capacity, percent of ventilators currently available, and our daily testing capacity, these are all indicators that were part of the original monitoring metrics. It also included the positivity rate and a case rate, but the case rate went from a 14-day case rate to a single-day case rate. That 14-day case rate had a threshold of 100, and basically what the state did is they took that 100 and divided it by 14. They got 7.14 and actually rounded down. So through the blueprint for a safer economy, our metrics got a little bit more restrictive in terms of the case rate. But the good news is if you look here, we're meeting all of the original county monitoring metrics, and we've met the threshold to move to the red tier for our case rate. Our testing positivity rate, however, puts us in the orange tier. And what this means is that we're actually in the 3rd tier for our testing positivity rate. But the way that it works with the tiered system is you have to stay in the most restrictive tier. So because our case rate is in the more restrictive tier, that's where we stay. The reason that that case rate and the tiered system is so important for us when we think about school is because schools in Ventura County will be allowed to reopen for in-person instruction beginning tomorrow without a waiver. So as early as October 21st, all schools K through 12 are able to open without submitting a waiver. And I'll talk a little bit about the waiver, the dates regarding when we started accepting waivers on a subsequent slide. So this is great news for us in Ventura County because the governor decided the week of July 13th, when transmission was at an all-time high within our community, but also in California, that communities that had a case rate above the 100 threshold for that 14-day case rate had to close for in-person instruction, except for if they submitted a waiver through K through 6 schools. So we'll talk about that and our data at that time in a little bit. If you want to go to the next slide, Salita. So the health equity metric was added about 2 weeks ago, and the health equity metric was put in place because what we're seeing here in Ventura County, in California, and really across the United States is that low-income Black, Latino, Pacific Islander, and essential workers really have been disproportionately impacted by COVID-19. And in Ventura County and other counties, we have differences in our testing positivity rates between our more affluent areas and our less affluent areas. And so what the California Department of Public Health decided to do is they implemented a metric based on the Healthy Places Index. And the Healthy Places Index is an index that was developed by the Public Health Alliance of Southern California. It's a consortium of health departments in Southern California, of which Ventura County Public Health is a member. And the Healthy Places Index basically is an aggregate index of many different social determinant of health indicators, education being one of them, housing status, median housing pricing. Other metrics that affect overall health and wellness are all aggregated into a single index. And so what they do is they take all of the census tracts within Ventura County, take the data, I believe it's 32 different indicators are included in that Healthy Places Index. They take the data for that and they develop a score from 0 to 100 for all of our census tracts. Those census tracts in our community that have a score closer to 0 have less than ideal healthy conditions, and those census tracts in our community that have a score closer to 100 have more ideal healthy conditions. And it tends to be those areas of higher socioeconomic status have a score closer to 100, and lower socioeconomic status areas have a score closer to 0. These also happen to be the areas with the lower Healthy Places Index score that are more disproportionately impacted by COVID-19. So if you look at the graph here, you'll see the line that's thicker in blue. That's our Healthy Places Index lower quartile positivity rate. So what they did with all of the Healthy Places Index scores for each of our census tracts is they divided all the scores or all the census tracts into bins, basically. So the bottom 25 are in the lowest bin, the next are in the second bin, above 50 to 75 are in the third bin, and then 75 and above are in the fourth bin. And they take that lowest 25% basically and create a score, a positivity rate for that lowest quartile that we have here in Ventura County. And so in order for us to move to the less restrictive tier, our testing positivity rate for the lower HPI quartile must also meet the metrics to move through that tier. So if we look here, the blue line again is our lowest HPI quartile. The jagged black line is the overall rate for the county. As long as we're below the purple line that you see there, we're able to move to the red tier. As long as we're below the red line, we're able to move to the orange tier. And as long as we're below the orange line, we'd be able to move to the yellow tier, which is the least restrictive tier. You'll see that right now in Ventura County, we are meeting the metrics to be able to we've moved to the red tier and we're meeting the metrics to be able to move further to the orange tier. It's just our case rate that's preventing us from doing so right now. And tomorrow, as I said, we're going to be overall at 2.4%, and the lower HPI quartile is at 3.1. In our community, we actually have the range between the lower HPI quartile and our overall rate is not as large as it is in other communities within California. In addition to meeting the metric for this positivity rate, counties also must submit a plan about how we intend to invest more heavily in these impacted communities. And the good thing for Ventura County is that we've been doing this all along. Our health education department has been boots on the ground, providing information to residents and also businesses in these lower HPI quartile areas where there tend to be more essential workplaces open. Our COVID compliance has also been working with essential workplaces on their reopening plan and ensuring that they have all industry guidance and proper precautions in place to prevent transmission of COVID in these communities. And then we've also developed a targeted investment plan that includes what community partners that we're working with in these communities. And one specific thing that we've been doing for the schools is we set aside funding from the Payment Protection Program funding that we received at the county, $260,000 for those schools that are in the Ventura County Businesses Services Authority. This is 10 schools of which students in these lower HPI quartile areas do attend these schools. And we set aside funding for them to be able to purchase infection prevention supplies in order to support them going back to in-person instruction. So if you want to go to the next slide, Salida. So this just shows you a map. A lot of people really don't know what their census tract is or where they live in terms of the census tract. And so what we did, you'll see the darker blue areas, that's our lower HPI quartile. And we've overlaid the zip code so that you can kind of get an idea of where they are. It's mostly South Oxnard, Port Hueneme area, the west end of Ventura, the Santa Clara Valley area. We do have a census tract in Moore Park and also in Simi Valley as well, and then several in the unincorporated areas of our county. But you'll see it tends to be more in the West County versus the East County, and these are the East County, we have higher socioeconomic status in those communities. In West County, we have lower socioeconomic status, and so it really falls in line with the Healthy Places Index score. If you want to go to the next slide, Salita. So this slide's pretty busy, but what we're doing, in addition to the state of California releasing our data on a county level, what we're doing is every week we're going to be releasing the data by zip code so that you can see the tiered metrics for your specific community. And so we released the previous week and then the current week for the measurement period. For this one that's coming out tomorrow, the data is through October 10th. And you'll see right now we're talking to parents and staff from Moore Park. So if we want to look at the 93021 zip code for week ending October 10th, we are at 4.5 for our case metric. And that 4.5 is actually within the red tier. And it's a little bit lower than the overall county metric. And then for the positivity rate, we are at 3.3%, which actually qualifies for the orange tier. Now, I will say with the data, looking at the zip code level, just a few cases can cause an increase in the overall case rate. For the week ending October 10th, we actually only had 350 cases for that entire week. So you see when we start to break it down by each zip code, it's actually quite a small amount per zip code. And so what we're going to also do on a weekly basis is if there's some sort of outbreak, let's say in a congregate living facility, or a few weeks ago we had an outbreak at the main jail that was causing an elevation in the 93003 rate. But if we find anything that caused an increase in the rate that would put the community in a more restrictive tier, but without that outbreak situation, they would be in a less restrictive tier, then we'll make a note of that below so that there's more information provided. But again, the purple is the highest risk tier. It's a positivity rate above 8 and a case rate of 7 or above. The red is the second highest tier. It's a positivity rate between 5 and 7.9 and a case rate between 4 and 6.9. The orange, which is the third highest risk tier, is a positivity rate between 2 and 4.9 and 1 and 3.9. And then the yellow, which is the lowest risk tier, is a positivity rate of less than 2 and a case rate of less than 1. In order for us to meet the metric to move to the red tier, we had to report an average of less than 60 cases per day in Ventura County for a population of 853,000. In order for us to move from the red tier to the orange tier, we have to be below 34 cases per day. We're really averaging more like 47 cases per day. So we've got some work to do in order to move to that orange tier, but we're consistently meeting the metrics for the red tier. If you want to go to the next slide, Salita. So this shows some trend data in terms of our daily case rate. You'll see in early June, as we started opening things up here in Ventura County, that's when our cases began to climb. That's also when we increased a lot of our testing capacity and also opened up testing to asymptomatic individuals. So that's also a function of and a reason why our case rate increased at that time. We had a little bit of a dip in June, but then 14 days after the 4th of July holiday weekend, we had an increase that sustained for a few weeks. And then starting in early August, we began a sustained decrease in our case rate. We had a couple outbreaks in late August that caused a little bit of a jump, but since then we've been on the decline, and our 7-day moving average and 14-day moving average has decreased significantly. I will say that when the governor first put in place the restriction on in-person instruction for educational facilities in mid-July, that even though we were allowed to accept waivers at that time, Dr. Levin didn't feel like community transmission was at a rate where he felt comfortable bringing all the kids back to in-person instruction. So he actually took a more slow and thoughtful approach to that and didn't allow for schools to submit waivers until August 19th. However, most schools Moorpark is one of the only public schools that actually did submit a waiver. It wasn't our intention in public health to increase our disparities in our community by allowing the waiver process to have children of higher socioeconomic status in the private school environment get to go back to in-person instruction while our public schools remained on distance learning. And so we're really glad to be in the red tier, in the less restrictive tier, to take the waiver process out of the way and allow for all schools to reopen for in-person instruction. I was on a call, I think it was last week, for the maternal, child, and adolescent health directors, and they were talking about a study out of UC San Francisco where they looked at rates of utilization for distance learning for higher socioeconomic status and lower socioeconomic status children from March through May. And 38.4% of children in lower socioeconomic status households did not engage in distance learning at all, compared to 4% of higher socioeconomic status children. And so with the distance learning environment, we are really losing those most vulnerable populations. And so that's why we're really encouraging the in-person instruction for those children. If you want to go to the next slide, Salita. The testing positivity rate, again, shows the same information and trend as the case rate. For our testing positivity rate, we've actually only gone above 8, which is the most restrictive tier, a couple of times during from June through October 10th, which is the latest data that we have available. But you'll see it follows the same kind of trend. And again, tomorrow we will be reporting out at, I think, our lowest that we ever have at 2.4%. And we've even expanded our testing capacity here in Ventura County. If you want to go to the next slide, Salita. So this slide shows the daily number of hospitalized COVID-19 patients. This is a past 3-day average from June 1st through October 19th. It follows the same trend line as the case rate. As we have more people that are diagnosed with COVID-19 and that more community transmission, we're going to have an increase in our hospitalizations. And that's just a matter of a certain percentage of people that get COVID-19 are going to require acute care support in the hospital environment. One thing I will say about our hospitals and our emergency medical system is the original Stay Well at Home order was put in place to allow for our hospitals to plan for a surge capacity for COVID-19. And the hospitals in our community really rose to the challenge and all worked together with our emergency medical services to be able to plan for that surge. We have not had to implement any of the surge capacity plans, but they have great plans in place should they need to do so that expand the hospital bed capacity beyond, I think, an additional 800 beds to outside of the facility even to allow for any surge that would happen. Today, as of October 19th, we have 30 COVID positive individuals in all of our 8 hospitals in Ventura County. Over the past week, we're getting back to our kind of pre-June levels of hospitalized patients in the 20s, and we had a little increase on. We always have a bit of an increase on Monday because people tend to seek healthcare after the weekend. And but even last week, we were reporting 28 and 27 in all of our 8 hospitals. So I don't know, do I have one more slide, Salita? Okay, I couldn't remember if I added this one in. This is just a summary table of our metrics overall. What I really want to point out on this slide is that we have currently in Ventura County only 489 active cases of COVID-19. So these are people, and it really should say under isolation rather than quarantine here, because these are people that are isolating at home, but it's a really small population of people that are currently active and symptomatic or within their isolation period. And this number for a while was 1,500, 1,600 cases I have to apologize. I'm outside in the backyard, and so you can probably hear a dog barking right now. But so we're below 500, and we've maintained that for quite some time. And we're reporting fewer cases than we have in a really long time. And so we're really at a place where community transmission is low within Ventura County, and very specifically in some communities, it's almost non-existent, depending upon which community in which you live. And what we found, and Salita will talk about this earlier, is that where community transmission is low, that when kids go back to school for in-person instruction, there's very low transmission in the school environment. And we're actually working with a company called Qualtrics to implement some automated contact tracing. And they've been doing a study with Brown University where they're aggregating data from 47 different states for schools that have returned to in-person instruction. And in the last 2 weeks of September, they followed over 200,000 students. And the infection rate among students was 0.13%, which equates to about 1.3 cases in a school of 1,000 students over a 2-week period. And the infection rate among staff members was actually 0.22%, which equates to 2.2 infections among staff of 1,000 or more. And so what we're really seeing is very low transmission in the school environment, especially if precautions for that the CDPH has put forth and the Ventura County Public Health Department has put forth are followed, and those of the essential workplace are followed. So with that, I will turn it over to Salita, and she will talk more about what the health department is doing to work with the schools to try to provide support as we return to in-person instruction.
Thank you so much, Erin. That was wonderful, as always. We certainly appreciate that you can share the most recent data. So every presentation that we've done over the last several weeks for parents and school staff has been a little bit different as our rates have dropped. So I'm going to talk a little bit about some of this you probably already know, hopefully you mostly know, what COVID-19 is, how it's spread, how we're preventing spread in our community, where we're having some success with that, and then also to talk to you a little bit about our work with the schools. And then I'm going to go over some of our most commonly asked questions. So COVID-19, as you all know, is a new virus. It's a coronavirus. It's in that coronavirus family, and it hasn't previously been seen in humans. So this is definitely a new virus causing our current pandemic. It's mainly spread from person to person through respiratory droplets. Those droplets that are produced when somebody coughs, sneezes, or talks, and then it can land in mouths, noses, or eyes of the people that are in close contact with one another. So that 6-foot social distancing method that we're using to prevent spread is really critical because this is a respiratory droplet transmissible virus. So some of the things that we've learned about COVID, and Erin typically says this, but I'll say it, one of our only constants with this whole COVID-19 pandemic is change. The direction from the state has changed frequently, our local data has changed, and just what we've learned about the virus since March has changed so much. And so actually even before that, since January. At the very beginning, the 3 hallmark symptoms of COVID-19 were fever, cough, shortness of breath. And then we started to notice that there's a whole bunch of other symptoms that have started to show up that were indicative of COVID-19 as well. And typically the symptoms can show up anywhere from 2 to 14 days after exposure to the virus. So this is something that's a little bit more unique with this virus, is that it has a really long incubation period. So that's part of why when people are asked to quarantine, it's 14 days, because we don't know when those symptoms are going to show up for that person. And these are some of the other symptoms that we're noticing: fatigue, body aches, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. And typically somebody will have more than one of these symptoms together. One of the things that the other hallmark symptom that's very unusual is a new loss of taste or smell. So that's also something that's really indicative of a COVID-19 infection. So one of the things that in working with the schools that we've done is put together some ways that the schools can quickly identify When should somebody be sent home, sent for testing? What are they looking at as far as symptoms go? And so this is a piece of our students' symptom decision tree that the schools have. Low risk symptoms are those fatigue, body aches, congestion, nausea, vomiting, sore throat, headache. And then again, our high risk red flag symptoms, these are the ones that are really indicative of COVID-19. So the state actually has a temperature threshold of 100.4. In Ventura County, we've lowered that even more to a threshold of 99.5. We consider that to be a febrile person. Dr. Levin has worked as a pediatrician and as a physician for many, many years, and that number has always kind of held true for him as far as what constitutes a fever. We do obviously have people that are asymptomatic as well. And so those are the ones that we don't necessarily know have it, although their chances of spreading COVID-19 are far lower than if somebody were symptomatic. So Aaron kind of alluded to this. This is recent from the CDC, that the scientific studies are suggesting that COVID-19 transmission among children in schools may be low. International studies that have assessed how readily COVID-19 spreads in schools also reveal low rates of transmission when that community transmission is low. Based on current data, the rate of infection among younger school children and from students to teachers has been low, especially if proper precautions are followed. And we're going to talk a little bit about that. There have also been few reports of children being the primary source of COVID-19 transmission among family members. This is consistent with data from both virus and antibody testing, suggesting that children are not the primary drivers of COVID-19 spread in schools or in the community. No studies are conclusive, but the available evidence provides reason to believe that in-person schooling is in the best interest of students, particularly in the context of appropriate mitigation measures similar to those implemented in our essential workplaces. So for preventing COVID-19 transmission, hand hygiene, and that is something that public health promotes constantly about good hand washing, using an alcohol-based hand sanitizer that's at least 60% will reduce transmission of COVID-19 and many other illnesses and diseases by breaking that outer layer of the virus and preventing cross-transmission. So really promoting proper hand washing, not only for ourselves as adults and parents, but also for our kids as well. Face coverings, wearing a mask or some type of face covering, it can slow the spread of COVID-19 by really inhibiting the release of the virus into the air. And ideally, you want to have something that is 2 or more layers, something that if you held it up to the light, you wouldn't necessarily be able to see much of the light coming through. And also ensuring proper wearing of that mask, making sure that it's really covering the nose and mouth and fitting well underneath the chin, again, to inhibit respiratory droplets from escaping. And then the social distancing aspect. Because those respiratory droplets are produced when someone coughs, sneezes, or talks, keeping that distance of 6 feet in between people at as much as possible to avoid having that virus spread that way as well. So the social distancing is really working also. So again, prevention, hand washing, social distancing, face masks are really showing to play a really big role in reducing our community transmission of COVID-19. So I just want to talk a little bit about some of our guidelines with the schools. We've actually been working with the schools since back in May. We knew that school was going to look different come fall. And we were so hoping that things would be able to open back up more normally. I think this caught a lot of people off guard and just has lasted a lot longer. And so we've started working back with the schools back in May and putting a team together here to support our schools, working closely with VCOE, working with CDPH to identify what were going to be the things that needed to be in place in order for schools to open safely for students and staff. And so using CDPH guidance, we also developed some guiding principles from Ventura County Public Health for our schools to follow to develop safe reopening plans. And this is just some of the things that are in those reopening plans, either active or passive screening of all students and staff, that temperature threshold of less than 99.5, the wearing of face coverings for students and staff, and I'm going to talk a little bit more about that. social distancing, maximizing the use of outdoor space, and then contact tracing. So for the contact tracing piece of it, this has also been something that's really important for the schools, is that when a student or staff is in a particular classroom, the school knows better than we ever will who that person may have been in contact with. So the school staff are actually helping us to create a list of school contacts to a positive case. And then they're notifying us of those contacts so that we can continue following up. The whole point is to prevent an outbreak in our schools. So we have identified liaisons the schools have identified liaisons for the districts to work closely with us as well, so that we had frequent and quick communication, streamlined communication with all of the schools and our public health department. So those school liaisons, the school districts have identified at least 2 for each district, and they're looking at things like absenteeism of staff and students to see if there's any potential trends. They're helping us with the contact tracing that's happening on school campuses so that we know who the contacts are to a positive case on campus. They're also responsible for providing communication to families and staff. So when they get communication from us, then they pass it on to their schools and their school staff as well as families. And then again, that really close collaboration with our Ventura County Public Health team. We're here to support them and really working closely with those liaisons. So these are just some of the resources that we have available, and we can also make sure that this gets sent out. And I think Dr. Hayes is going to provide a copy of this PowerPoint, both the PowerPoints, the data as well. VenturaCountyRecovers.org is a great place to get up-to-date information on Ventura County and COVID-19. So I would definitely recommend going there. We have information on our testing sites. We have a lot of information for the schools there now as well too. So I'm going to go to, I'm going to stop sharing this here. All right, so I'm just going to cover a couple of key areas that we get a lot of questions on. We've had questions from parents and families as well as teachers and staff. And so we've created an FAQ sheet for schools to cover some of these key areas. So I'm going to go through some of them for you. So a lot of questions come up around the criteria for opening and reopening schools, depending on where we're at. So one of the things that's really important is that if for whatever reason we end up going back a tier, we go back to a more restrictive tier, schools will not be required to close. Once they're open, they can remain open. The only time that they would need to close back down is if there was an outbreak at a particular school. And that's our whole focus, is to prevent that from happening. So if we do go back to the purple tier, then schools would be able to remain open. So the individual school closure is recommended based on the number of cases and then the percentage of the teachers, students, and staff that are positive for COVID-19, and then also in collaboration with Dr. Levin, our health officer. So individual school closure may be appropriate when there's multiple cases in multiple classes at a school, or when at least 5% of the total number of teachers, students, or staff are cases within a 14-day period. And it really depends on the size of the school and the way that the school is laid out. And then our health officer may also determine school closures warranted for other reasons, depending on the results of a public health investigation into cases at a particular school or other local epidemiological data. If a particular community is experiencing more widespread transmission, then we might look at closing a school temporarily as well. Schools can open after 14 days. And that is if we close a school down. So I'm going to talk about if we just have, 1 or 2 cases. But if an entire school had to close because they had a large outbreak, there would need to be the cleaning and disinfection, a public health investigation so that we could really evaluate how that happened and what we can do differently in the future. And then really close collaboration with the local public health department. And then a superintendent could close a school district if 25% or more of the schools in a district have closed due to COVID-19 within 14 days. So these are the really extreme situations that we don't anticipate happening. However, we have plans in place for if they do. So with that being said, routine screening and testing, all students and staff should be screened for a temperature of 99.5 or higher. and then also screened for COVID symptoms prior to arriving on campus. And that's that passive screening piece of it. So we really are relying on parents to ensure that their children are feeling well before they go to school, and relying on staff to, to also be feeling well before they go to campus to work. With that being said, we also know that active screening may take place when people arrive on campus, and that will be up to the individual school and how they're able to make that happen. Not all schools can do active screening for everybody. At this time, as far as testing, California Department of Public Health states that school staff should receive COVID testing every 2 months as part of routine screening for COVID, and staff are able to use our testing sites in order to go. Okay, just making sure everybody stays muted. And so we do have those drive-up sites as well as one walk-up site that are open to Ventura County residents for routine testing. And then as well, any of you hopefully are aware that we have these sites open too if you've been exposed or you're not feeling well yourself, that these sites are available for anybody who is a resident of Ventura County to go and get tested. Students are not required to be tested on a routine basis. That is not a current requirement of California Department of Public Health or CDC at this time. Mask requirements. So masks are required for all staff and students 3rd grade and up. That is an absolute requirement. There are very few that would qualify for a mask exemption. For pre-K through 2nd grade, masks are strongly encouraged, although they are not required by CDPH or Ventura County Public Health. However, a school can require that those younger kids also wear masks during the day. That is up to the school to decide. We do strongly encourage those younger kids to wear masks though. Obviously, masks are not required to be worn while eating. So they can be removed while eating or participating in physical activity outdoors when at least 6 feet of distance can be maintained. So if they're outside, running or doing activities that require separation or distance between them, they can remove their masks for that. If they're playing at recess, masks would need to be on because we know that the kids are going to be a little bit closer together if they're playing together during recess time. For mask exemptions, we do get a lot of questions about that. And per the CDPH, as well as Ventura County Public Health, mask exemptions are only for those with a medical condition, a mental health condition, or a disability that prevents wearing a face covering. This includes people with a medical condition for whom wearing a face covering could obstruct breathing, or who are unconscious, incapacitated, or otherwise unable to remove a face covering without assistance. And that would require a doctor's note and would be evaluated by the school nurse. Those with mask exemptions really should wear a non-restrictive alternative, such as a face shield that has the drape on the bottom edge if their condition permits. And then, like I mentioned before, cloth face coverings really should be made from cotton. That's the best material and should be at least 2 layers or more. Net gaiters are also acceptable as long as they meet that criteria. Other areas that we get a lot of questions in are what is an exposure? What counts as a close contact? Or when do I have to quarantine? When do I have to isolate? So I'm going to go over a couple of definitions for you. The first being the definition of a close contact. There's a misconception that if one person in a class is positive, that the entire class would have to quarantine. That's not necessarily true. A close contact is someone that has been less than 6 feet for 15 minutes or more, either at once or cumulatively throughout the day, with a person that has COVID, with or without masks. So obviously they're going to be more at risk, more of a close contact if there were no masks being worn, less of a possibility of being a close contact if both parties were wearing masks. The risk of transmission is obviously higher in that situation, but it's also higher if the person is symptomatic. The definition of quarantine is 14 days from last exposure to the confirmed COVID positive person, regardless of whether or not they themselves had a negative COVID test. And the reason for that is because of that long incubation period of 2 to 14 days. So we found that you could test maybe at day 3 after being exposed to somebody with COVID, and your test could be negative, but then your test may turn positive on day 10. So we use a symptom-based strategy or a non-test based strategy to determine quarantine. So it is 14 days if you're exposed to somebody that is COVID-19 positive. The definition of isolation is 10 days from the onset of symptoms or that positive COVID test. And the person also has to be 10 days out, no fever for 24 hours without the use of fever reducing medication, and then also improvement in their symptoms. So those three things have to be in place in order for them to be considered no longer on isolation. We don't require a negative test for them to come off isolation because of that 10-day period. And we also don't require a doctor's note releasing them from isolation. Once they've hit that 10-day mark, as long as they no longer have a fever and their symptoms have improved, they are considered cleared from isolation. So we have put out a couple of documents to help our schools to really navigate through a lot of these different scenarios with our students. We know that kids go to the nurse's office for a variety of different reasons throughout the day. And so really being able to support the schools in identifying who is more at risk for being COVID positive or an exposure, identifying what those symptoms might mean and when to send somebody home and request that they get tested. If a child's been ill, has a negative COVID test, and hasn't been exposed to anybody with COVID, they can actually return to school after 24 hours without fever, again, or without the use of fever reducing medication and improve symptoms. And we also know that there's other alternative diagnoses for fever, something like a bladder infection or an ear infection. And so a doctor's note might be needed in that situation for them to come back to school. And then also we know that we have students that might get an upset stomach before a test, maybe get a headache if they're experiencing increased stress at school. And so there's also pathways for school staff to navigate through that as well. If a student or staff, again, test positive for COVID, they will isolate for 10 days. The students should have access to distance learning during that time. And then the schools are working with the staff to ensure that they have access to distance teaching if they are teachers or other accommodations for them, depending on their setup. The school will notify the close contacts that they were exposed and that they will need to quarantine for 14 days. And we will actually work with positive students and staff to identify other close contacts outside of the school setting. And we'll monitor symptoms and progress along with them. And like I said, neither COVID positive nor exposed individuals need to provide a negative COVID test prior to returning to school. Some of the other questions that we get as far as, how will this be enforced at the schools? There's a lot of questions that come up that are very district specific. And so you would need to reach out to the school administration where your child attends. But really we're asking, just like we do with the general community, for everybody to participate in our prevention techniques, which are hand washing, wearing face masks, and social distancing. If we all continue doing what we've been doing, our community transmission rate will continue to be low. Things like class sizes are really dependent on the number of students that can be in a space, in a classroom space, with 6 feet of distance. So that is really, really important. If people are socially distanced in a class and everybody's wearing a mask, again, that entire class may not be considered a group of close contacts if there is a positive case. Things like nutrition and lunch, those ideally should be outside if at all possible. We know that every school is set up a little bit differently, and so you might need to check with your own school. I think the majority of the parents that are on tonight are middle and high school parents, and so you would need to really reach out to your school as far as how does that look on that campus. We really advocate for as much outside time as possible. We live in a beautiful county with almost perfect weather most of the time. We know we've had some heat waves, and we definitely want to say weather permitting to spend as much time doing having outdoor nutrition, especially because that's when you don't have your mask on, as possible. So again, we do know more about COVID now than we did in March. And again, with the initial shutdown, really trying to set up our hospitals to be ready for any type of surge capacity, like Erin mentioned, and to decrease our positivity rate in the community. We feel very confident that we are not going to see large outbreaks when schools reopen, as long as everybody is practicing those prevention measures and really working closely with us in public health. Some of the other things that have come up recently, and California Department of Public Health actually has addressed this, even as of Friday, they changed their guidance again on band. So with band and singing, ideally outside, wind instruments are strongly discouraged. Singing and string percussion can take place outside. With singing, they need to have masks on and be at least 6 feet apart, preferably further apart. There's a lot of guidance on sports as well. Competition is still not allowed by the state of California for sports, only individual conditioning, but at least our students and athletes can get back to some type of conditioning work for their individual sports. Let's see. And then as far as things like PE, I think I covered that a little bit already, that they may have a different plan for PE and physical activity for our high school and middle school students. Recess, not so much of a thing, but we do have PE and sports classes as well. So with that, I think I've covered just about everything on our list. Some of the other questions, can schools exclude students from class who refuse to wear masks? Yes, that is up to the school, and they can provide distance learning. We also get asked if they can use face shields instead of masks. Face shields are not a substitute for masks, but they may be worn in addition to masks. Let's see. Some of the other questions that came up that was really interesting actually had to do with fire drills and lockdown drills that schools are required to perform, ideally at the beginning of the year and then a couple times throughout. Fire drills can still be conducted by an individual classroom in order to adhere to social distancing requirements and still learn the evacuation route. So rather than doing a school-wide fire drill, they can do class by class. And then lockdown drills can have students down on the floor next to their desk instead of congregating in one corner of the room. And then providing that education if a real event were to occur. Obviously, in the event of an actual emergency, social distancing is not the priority. The safety of students and staff is, and so evacuating, however way you need to be safe is the priority there. And that, I think, we've gotten most of our questions. I think that I can take chat directly to me. If anybody has any questions and wants to chat, we can take a couple in the chat. If anybody has any. I'm not seeing any. Okay. So we're actually going to wrap up a few minutes early. We really, really hope that this has been helpful for all of you. I realize that we may not have answered everybody's questions. There are many questions that are specific to the district, and I encourage you to reach out to your school's administration to ask those questions. We do work with our school liaisons very closely, and so if there is a question for public health that they can't answer, they know how to get in touch with us so that we can answer that question or address that for them. We know that the social distancing in kindergarten, yes, that also has come up. We really try to keep those kids 6 feet apart. The key though is that as long as they're wearing masks and frequent hand washing for keeping kids socially distant in kindergarten, that is the best that we can offer. We've also seen in classrooms that have had the plexiglass dividers on round tables. Ideally, we really want those kids to be 6 feet apart if at all possible. And yes, masks can be mandated in kindergarten by the school. Anybody over the age of 3 really can and should be wearing a face covering when in public. Okay, So that was one question that came in there. So again, just wanting to thank you all for your time tonight. And, please know that we're working very closely with the schools to ensure that school reopening is going to be as smooth and safe as possible for not only for our students, but also for the school staff. And with that, we're going to go ahead and conclude tonight. I think we still have one more question. If the virus is not spread via surface contact. I think that question is on our school FAQ. We do still want to wipe things down to keep things sanitary. There's not a lot of evidence that that the virus spreads as easily on hard surfaces. It is more to the person-to-person close contact because it's mostly respiratory droplet spread. So with that, we're going to go ahead and conclude. Thank you all so much for your time tonight. We really appreciate it. And on behalf of us here at Public Health, stay well and take care. Thank you.
It was like, oh my God, she's typing a lot. She's talking a lot and fast.
I know, we've done this a lot. So I'm going to stay on though. So if you have a question or need me to clarify something, I mean, you can stop and ask me and I'll respond to you, and then we